Welcome to the MD Edge Daily News for Thursday, June 28th. Today, we're focusing on addiction. I'm Nick Andrews.
And I'm Denise Fulton. Today, buprenorphine endangers the lives and health of children.
Also today, cocaine use is declining among young adults.
If you can't find your hepatitis C patient, he's probably on a smoke break.
But we begin today with the treatment of opioid use disorder among U.S. veterans. Less than 30% of veterans who are on medication-assisted treatment for opioids have not been diagnosed with opioid use disorder. Only 7% of veterans with an opioid use disorder initiated medication-assisted treatment. Dr. Lisham Ashrafion is an investigator with the Veteran Affairs Center of Excellence for Suicide Prevention at the Canandaigua VA Medical Center in New York. Dr. Ashrafion says that one might expect that the percentage of people who are receiving medication-assisted treatment for opioid use disorder would be high. Dr. Ashrafion and his colleagues evaluated data from over 200,000 veterans who initiated specialty pain services between 2012 and 2014. Only about 2,400 veterans received medication-assisted treatment, and only about 1/4 of those had an opioid use disorder. In adjusted analysis, opioid use disorders and opioid prescriptions were significantly associated with greater odds of receiving MAT. Having a diagnosis of depression was associated with greater odds of receiving medication treatment, while having a diagnosis of PTSD or alcohol use disorder were associated with a greater odds of not receiving it.
From MD Edge Psychiatry, buprenorphine poses serious risks, including death, to children who are accidentally exposed to the opioid use disorder treatment, prompting researchers to call for better patient education and proper storage techniques. This is according to a database review published in Pediatrics by researchers at Nationwide Children's Hospital in Columbus, Ohio. Between 2007 and 2016, Poison Control Centers received more than 11,000 calls about children ingesting buprenorphine. 11 children died. Investigators report that from 2007 to 2013, children's exposures to buprenorphine doubled, coinciding with the increase in prescriptions after the drug was approved by the FDA in 2002. Since 2013, when the sublingual formulation was introduced, the rate of exposures has dropped somewhat. 98% of the exposures in the study were unintentional and involved just a single dose of buprenorphine. However, that can be extremely dangerous for a small child. The average age of the children in the study was about 4 years. Ingestion of a single 2 mg tablet in a 10 kg child can result in an overdose of 30-fold. The American Academy of Pediatrics advocates for increased access to buprenorphine for adolescents who are addicted to opioids. And while that access is needed, investigator Sarah Post said it should be accompanied by caution and education. She says that child-proof packaging for all buprenorphine formulations could help protect younger children.
Use of cocaine by young adults in the United States has declined significantly since the early 2000s, but it remains relatively common. About 5% of people aged 18 to 24 years have used cocaine in the past 12 months. This is according to the results of an analysis reported at the College on Problems of Drug Dependence in San Diego. Researchers report that 12% of young adults had ever used cocaine, about 6% had used in the past 12 months, about 2% had used in the past 30 days, and about 1% had a use disorder in the past 12 months. Kristen Schneider is a graduate student in the Department of Mental Health at Johns Hopkins University in Baltimore. She says that we don't typically think of cocaine use among young people, but if someone has risky alcohol use, they might also have risky substance use. Ms. Schneider says that while most interventions focus on alcohol interventions, these behaviors should also be screened for.
Finally today, a cigarette smoking epidemic runs in tandem with the hepatitis C virus epidemic. This is according to the results of an analysis of data between 1999 and 2014 published in the American Journal of Medicine. Researchers evaluated data from nearly 40,000 adults in the National Health and Nutrition Examination Survey. They report that patients with hepatitis C virus were almost 3 times more likely to be smokers compared to those who did not have the virus. Further, patients with hepatitis C who smoke were more likely to be older, male, Black, less educated, poor, and uninsured. They were also more likely to use illicit drugs and be depressed. Multivariate analysis showed a significant association between hepatitis C virus infection and smoking with current depression and hypertension. Dr. Ryan Kim of Albert Einstein Medical College in New York says that it's a public health folly to continue to spend tens of millions of dollars annually on treating hepatitis C patients while ignoring the lethal addiction that affects more than 60% of them. Thanks for listening to MDH Daily News. You can find the links to these stories in the podcast description. I'm Denise Fulton.
And I'm Nick Andrews. You can make the daily news a part of your morning routine. Subscribe today, wherever podcasts are found.